Will the Committee of Supply please come to order? Before we begin, I have a leave request for this section of the Committee of Supply. Is there leave to allow the opposition to sit on the other side of the table to allow them to see the screens that are situated in the room? Leave has been granted. Agreed and so ordered. This section of the Committee of Supply will now resume consideration of the estimates for the Department of Health. Questioning for this department will proceed in a global manner. The floor is now open for questions. The member for Union Station.
Thank you. I have no further questions for the minister. And we'll wrap up this section.
Hearing no further questions, we will now proceed to consideration of the resolutions. At this point, we will allow virtual members to unmute their mics so they can respond to the question. I will now call on resolution number 21.2. Resolve that there be granted to Her Majesty a sum not exceeding $19,954,000 for health policy and accountability for the fiscal year ending March 31st, 2023. Shall the resolution pass? The resolution is accordingly passed. Resolution 21.3. Resolve that there be granted to Her Majesty a sum not exceeding $13,892,000 for health insurance for the fiscal year ending March 31st, 2023. Shall the resolution pass? The resolution is accordingly passed. Resolution number 21.4. Resolve that there be granted to Her Majesty a sum not exceeding $29,525,000 for health, population health for the fiscal year ending March 31st, 2023. Shall the resolution pass? The resolution is accordingly passed. Resolution 21.5. Resolve that there be granted to Her Majesty a sum not exceeding $76,091,000 for health transition for the fiscal year ending March 31st, 2023. Shall the resolution pass? The resolution is accordingly passed. Resolution number 21.6. Resolve that there be granted to Her Majesty a sum not exceeding $3,998,426,000 for health, funding to health authorities for the fiscal year ending March 31st, 2023. Shall the resolution pass? The resolution is accordingly passed. Resolution 21.7. Resolve that there be granted to Her Majesty a sum not exceeding $180,642,000 for health, provincial health services for the fiscal year ending March 31st, 2023. Shall the resolution pass? The resolution is accordingly passed. Resolution 21.8. Resolve that there be granted to Her Majesty a sum not exceeding $1,428,211,000 for health, medical for the fiscal year ending March 31st, 2023. Shall the resolution pass? The resolution is accordingly passed. Resolve that there be granted to Her Majesty a sum not exceeding $289,062,000 for health, pharmacare for the fiscal year ending March 31st, 2023. Shall the resolution pass? The resolution is accordingly passed. Resolution 21.10. Resolved that there be granted to Her Majesty a sum not exceeding $207,890,000 for health capital funding for the fiscal year ending March 31st, 2023. Shall the resolution pass? The resolution is accordingly passed. Resolution 21.11. Resolved that there be granted to Her Majesty a sum not exceeding $1,305,000 for health capital assets for the fiscal year ending March 31st, 2023. Shall the resolution pass? The resolution is accordingly passed. Resolution 21.12. Resolved that there be granted to Her Majesty a sum not exceeding $288,913,000 for health, other reporting entities' capital investment for the fiscal year ending March 31st, 2023. Shall the resolution pass? The resolution is accordingly passed. The last item to be considered for these estimates Oh. The last item to be considered for these estimates is item 1A, the minister's salary, contained in Resolution 21.1. The floor is now open for questions. The member for Union Station.
I move that line item 21.1A, minister's salary, be reduced to $21,000.
It has been moved by the honorable member for Union Station that line item 21.1A, minister's salary, be reduced to $21,000. The motion is in order. Are there any questions or comments on the motion? The member for Union Station.
Thank you. I just want to put a few remarks on the record in regards to this motion. We have been in a global pandemic, and we are facing unprecedented challenges in our healthcare system, and Manitobans need and are deserving of healthcare leadership that puts them first. And unfortunately, we've consistently seen this premier make decisions that do not put Manitobans first. And we've seen this Minister of Health make decisions that do not prioritize the health outcomes of Manitobans. And, you know, unfortunately, this government's decision-making time and time again has reflected that they are committed to moving forward, just perpetuating Brian Pallister's agenda, and it's hurting Manitobans across this province, which is why we've brought this motion forward regarding the minister's salary. Thank you.
Are there any other further comments or statements to be made? Is the committee ready for the question? Shall the motion pass? I hear a no. All those in favor of the motion, please say aye. Aye. All those opposed to the motion, please say nay.
Nay.
In my opinion, the nays have it. The motion is accordingly defeated.
That's the one you have. Just open it up. So, we will wait. Watch your mic.
We will now do resolution 21.1. Resolved that there be granted to Her Majesty a sum not exceeding $12,785,000 for health, resources, and performance for the fiscal year ending March 31st, 2023. Shall the resolution pass? The resolution is accordingly passed. This completes the estimates for the Department of Health.
Keep going straight from there.
The next set of estimates to be considered by this section of the Committee of Supply are for the Department of Mental Health and Community Wellness. Shall we briefly recess to allow the minister and critics the opportunity to prepare for the commencement of the next department? Agreed? Agreed and so ordered. Will the Committee of Supply please come to order? This section of the Committee Supply will now consider the estimates of the Department of Mental Health and Community Wellness. Does the Honourable Minister have an opening statement?
I do, Mr. Chair.
The Honourable Minister of Mental Health and Community Wellness.
Thank you, Mr. Chair. And on behalf of the Department of Mental Health and Community Wellness, I'm very pleased to present the financial estimates for the 2022-23 fiscal year. In doing so, I commit to making mental health and community wellness an effective and results-oriented department that will respond rapidly and effectively to the evolving mental health and wellness landscape in our province. The Department of Mental Health and Community Wellness was created in January of 2021 in response to the increased prevalence and complexity of mental health and addictions issues and increasing demand for services and supports. We are the first government in Canada to bring mental health, substance use, and addiction services, as well as wellness and health promotion programs together under one department. Department-led province-wide consultations, speaking to thousands of Manitobans, service providers, and experts about opportunities to improve mental health, substance use recovery, and wellness programs and services, has informed the development of an integrated, whole-of-government 5-year roadmap, a path to mental health and community wellness, a roadmap for Manitoba. The roadmap's vision is that Manitobans experience optimal physical, mental, emotional, cultural, spiritual well-being across their lifespan. Our focus will be on developing a more coordinated, accessible system where mental health, addictions, and wellness supports are available to Manitobans as close to home as possible. The proposed 2022-23 budget in core reflects an expenditure of $390.6 million and 66.2 staff years, or FTEs, an increase of $16.3 million from the restated 21-22 budget, or a 4.3% increase. In terms of summary, the 2022-23 Mental Health and Community Wellness Summary Budget is set at $399.2 million, representing an overall increase of 4.3%. This year's budget includes investments in the following. $17.1 million to implement the year one of the 5-year action plan to invest in core services and programs for Manitobans to make services more available and easier to navigate. The strategic area of focus for this investment will include the following. 1, equitable access and coordination. 2, mental well-being and chronic disease prevention. 3, governance and accountability. 4, quality and innovation. And 5, Indigenous partnership and wellness. $23.7 million is to support over 30 effective mental health and addictions programs and services across the province, led by the Departments of Mental Health and Community Wellness, Education, and Early Childhood Learning, and Families. This investment includes, but is not limited to, the following key priorities. Project 11, Thrival Kits, Integrated Youth Services, access to mental health emergency assessment and treatment services, school-based mental health supports for youth, Indigenous-led health services, withdrawal management services, sobriety, treatment, and recovery teams, RAM clinic expansions, eating disorder supports, acute medical sobering unit, community 24/7 drop-in center, and pregnancy and infant loss. Funding of $1.2 million in funding for mental health services to address wage and volume pressures, as well as supplies and drug cost increases for the following service delivery organizations: Shared Health, Winnipeg Regional Health Authority, Prairie Mountain Regional Health Authority, Interlake Eastern Regional Health Authority, Southern Health Santé Sud, Northern Regional Health Authority. Thank you very much for the opportunity to say a few words on this year's estimates. I'd also like to acknowledge my colleagues in families, education, and early childhood learning, justice, and health for their partnership and support in this important work to help improve mental health and community wellness across the province. I'd now be happy to answer any questions.
We thank the Minister for those comments. Does the critic from the official opposition have an opening statement? The member for Union Station.
Thank you. So I'm very clearly not the critic on this particular file. I'm here in place of my colleague, the MLA for Point Douglas today. And so I will keep my remarks short, but I do want to put a few words on the record in regards to this portfolio. Manitoba, when we talk about what's going on in healthcare, and we talk about mental health and wellness and community wellness, I think we all recognize that we're facing some very challenging times in the province. Manitoba families in every aspect of the province are navigating increased mental health challenges, and that includes challenges accessing mental health services and resources. Providers working within our care system and our care communities are struggling with limited resources to make sure that they can meet people's needs. And as the opposition, we've been advocating very tirelessly, and our colleague, the MLA for Point Douglas, has done a tremendous job advocating on behalf of families and service providers, in the hopes that this government will respond appropriately and accordingly to the needs of Manitobans. It's certainly a priority, I think, for everybody in the legislature and the assembly, rather, in terms of MLAs, to meet the needs of their constituents. However, there are some pretty clear concerns that we have in terms of how this government has been taking action or not taking action to address the needs of Manitoba families. We continue to see increased wait times in regards to accessing mental health services. We continue to see increases in overdose deaths, preventable overdose deaths, and a lack of action taken by this government in order to be preventative in terms of meeting people's needs. And so our hope is that in asking these questions, we also get a good understanding of what steps this government is going to take moving forward to meet the needs of Manitobans. Because at this point, when we're looking at unprecedented mental health challenges in Manitoba, we need creative and holistic and compassionate approaches to mental health and wellness in our province. I'll leave my remarks there. Thank you.
My apologies. Under Manitoba practice, debate on the minister's salary is the last item considered for a department in the Committee of Supply. Accordingly, we shall now defer consideration of line item 24.1A contained in Resolution 24.1. At this time, we invite the minister's staff to join us at the table, and we ask that the minister introduce the staff in attendance. The Honorable Minister of Mental Health and Community Wellness.
Thank you, Mr. Chair. I'd like to introduce my Deputy Minister, Kim Kaufman, for the department, as well as the Assistant Deputy Minister and Executive Financial Officer, Sandra Hnault, and Susan Crichton, Senior Advisor to the Deputy Minister, as well as my Special Assistant, Jeff Chachanoff.
According to our Rule 78, bracket 16, during the consideration of departmental estimates, question for each department shall proceed in a global manner, with questions put separately on all resolutions once the official opposition critic indicates that questioning has concluded. The floor is now open for questions. The member for Union Station.
Great, thank you. So I just would like to start $4.517 million. The explanatory note says that this was for, and I quote, various pilot project initiatives, end quote. Can the minister list those projects and provide me a bit of an explanation for each of them? Thank you.
The Honorable Minister of Mental Health and Community Wellness.
Yeah, could just ask the member to clarify which page they are referring to?
The member for Union Station.
Sure, one moment, yeah.
The member for Union Station.
Thank you. I'm going to come back to that. I'll move on to another question if that's okay. I'll get that page number for the minister in a moment. Can the minister provide me the names of her political staff?
The Honorable Minister of Mental Health and Community Wellness.
Thank you, Mr. Chair. Today, the political staff I have in attendance is Jeff Chachnoff, my special assistant.
The member for Union Station.
More broadly, can the minister provide the names of all of your political staff generally?
The Honorable Minister of Mental Health and Community Wellness.
Currently, Mr. Chachnoff is my only political staff in my office.
The member for Union Station.
Manitoba has an agreement with Canada for mental health and addiction support, the federal government. It's 100% federal dollars. How much of those dollars were allocated to the province in these two areas in fiscal year 2021, 2022? How much of those dollars were spent? And how much has the province requested be carried forward? So how much of those unspent dollars were requested to be brought forward?
The Honorable Minister of Mental Health and Community Wellness.
Thank you, Mr. Chair. Okay, so in the fiscal year of 21-22, the federal dollars that came to Manitoba was $23.7 million. $23.7 million, of which was $20 million was spent in year. 3.7 million was delayed due to some of the programs not being able to start because of COVID, and they were fully allocated and spent within this fiscal year of 22-23.
The member for Union Station.
I thank the minister for that response and for covering all of the asks I had within that. I'm going to go back to my first question about some clarity now. So the page number was 30. So for last year under mental health and recovery transition, there's a line for $4.517 million, and that's new money, $4.517 million of new money. What was that money for? And again, there are pilot initiatives outlined. If you could list, what those projects are, that'd be great. Thank you.
The Honorable Minister of Mental Health and Community Wellness.
Thank you, Mr. Chair. So, there was a line there for $4.517 million, of which only $500,000 was spent on consultation costs for the roadmap. So that included travel and meeting with various stakeholders and groups to get feedback about what we would involve in that roadmap, what the priorities of the communities were. And the remainder of 4.017 million, 2 million of which went to United Way for various projects that were chosen at United Way, where they felt the greatest need was and most impact would be. And then there's a list of a number of pilot projects that were invested in are cognitive behavioral therapy and mindfulness investments. Healthy Together Now pilot project. Child Nutrition Council of Manitoba received an increase in year. The nicotine replacement therapy program as well. And then I've mentioned the United Way proposals. There were some other investments as well that have not yet been announced, and I look forward to speaking about those in the coming weeks.
The member for Union Station.
Yeah, can the minister provide a little bit of clarity around some of these programs? So just, are there specifics available in terms of who runs these programs or who they're specifically attached to? So I've got the titles of them. There's a CBT program, there's mindfulness, there's Helping Together, the child nutrition, I think we have a good sense of, but not familiar actually with all of who would be responsible for delivering those. So if you could provide some clarity in regards to those details, that would be great.
The Honorable Minister of Mental Health and Community Wellness.
Thank you, Mr. Chair. Okay, so these pilot projects, so I'll go to the CPT, so that's the cognitive behavioral therapy and mindfulness investment, and that was funded through Shared Health. So that would be distributed through Shared Health to the various organizations that provide those services. The Healthy Together Now is administered through the department, but through different RHAs. So the different RHAs could apply to access that funding for their various programs. And I think the Child Nutrition Council of Manitoba is self-explanatory. The nicotine replacement therapy is administered through the RHAs. And of course, United Way proposals that were administered through United Way.
The member for Union Station.
Thank you. I have in front of me in our response rather, so information we received through Freedom of Information regarding an RFP put out by the Minister's Department rather, to develop a mental health roadmap. It's like a 5-year roadmap. And this is an agreement between the government of Manitoba and Optimus SBR Inc. Incorporated. Now, this agreement is for $450,000, nearly $500,000. Can the minister provide some clarity around why this RFP was commissioned? And given that we just recently had the Virgo report completed, and there are many recommendations from that report that I know this government has talked about addressing. And so why a $450,000 roadmap being RFP'd at this stage? So again, why was this another report commissioned? And can the minister provide any clarity around some of the details of what's come of it?
The Honourable Minister of Mental Health and Community Wellness.
Thank you, Mr. Chair, and appreciate the question coming from the member opposite. So we did issue the RFP out for proposals to actually address a number of different reports, not just Virgo. So you'll recall that the Peachy report really identified many gaps in the healthcare system and areas that needed to be addressed and really focused on, but it wasn't prescriptive. So it didn't go through the steps of how to achieve results or how to address some of those gaps. Similar, Virgo identified a lot of the difficulties and challenges within the mental health system and came up with 125 recommendations. So in order for us to come up with a 5-year plan to identify the priority areas that that could have the immediate impacts to benefit Manitobans, we did issue an RFP for consultation services to also identify and prioritize Indigenous communities within our 5-year roadmap. We wanted to hear directly from people with lived experience who worked within the mental health system about the areas that they would prioritize over the next 5 years so that we could be very focused and have the biggest impact and most benefits for Manitobans.
The member for Union Station.
So it sounds kind of like, and forgive me for being blunt about this, but it sounds like you commissioned a report to go to evaluate the reports that were already done. Like I guess I'm not very clear based on the information the minister has just provided. Commissioned a report to address the reports that have already been done and the recommendations that have been brought forward, a number of recommendations brought forward from Virgo. You mentioned, the minister mentioned Peachy as well. And minister has also referenced wanting to ensure that the needs of Indigenous communities are also being addressed, and you know, Indigenous communities are identified as part of those prior reports. So I think the issue I'm having with the minister's response is it's a bit vague, and the idea that a $450,000 report would be commissioned to address reports that have already been done and reports that this government has been saying that they are implementing the recommendations of, and yet we don't really have full clarity on how those recommendations, and I'll speak specifically to Virgo, are being executed and where this government is at in terms of that. So I guess I'll be really specific in this question. If the minister is saying that this report was commissioned to address the Virgo report, then what has come out of this commissioned report and what does it speak to specifically in regards to the Virgo report recommendations?
The Honorable Minister of Mental Health and Community Wellness.
Thank you, Mr. Chair. And I can appreciate if the comments that I made were not overtly clear, but the monies that were spent for this exercise involved consultation. So organizing conversations with over 3,000 Manitobans to get feedback from lived experience about parts of the various reports, including the Macy report, and how that would need to be integrated into our 5-year roadmap. So our 5-year roadmap is not just simply based on the Virgo report. It is based on a number of different reports of gaps in the system that need to be addressed in order to create an environment of better access for Manitobans to get mental health supports and addictions services. So the cost included in this contract included those consultations, direct feedback, and then honing in on the priorities that need to be focused on over the next 5 years in terms of addressing not only the recommendations in Virgo, but also in Macy and other reports that have come before the government.
The member for Union Station.
Does the minister have available to her the amount, out of that $450,000, what was allocated to consultations?
The Honorable Minister of Mental Health and Community Wellness.
Thank you, Mr. Chair. So the reason why there was a little bit of delay there is that the invoices that come in through the department for the contract, which is up to $450,000, they aren't broken down into what's spent on consultation versus what's spent on report writing. So the invoices that come through is all inclusive. So they would have, participated in the consultation processes. They would have compiled the information, and then they would have put that together and compiled it into a report, and then submit the bill for the costs altogether. So in order to break that down, we'd actually have to go back to the company itself to have those broken down. We don't have that information available to us.
The member for Union Station.
Okay, I thank the minister for that response. I may go back to that. I think I still have a couple. I've been going through this document. Unfortunately, most of some of the other documents almost entirely redacted, but I may go back to that and ask a couple of more questions, but I'll move on for now. So my next question is in regards to federal funding. So Manitoba is receiving tens of millions of dollars a year from the federal government for mental health and addictions. Why is the report consolidated spending, the reported rather consolidated spending for the department down $5.8 million this year? So 2021, 2022, and it's on page 26 of the annual report.
The Honorable Minister of Mental Health and Community Wellness.
Thank you, Mr. Chair, and I hope I convey this as clear as I can. So the numbers that you were looking at were summary budget numbers, and summary budget includes a number of different entities within it, some of which we don't have direct control or direction in through our department. For instance, a number of RHAs run parking lots and they get revenue and they decide what they spend that on, and they can determine what areas to spend that in. We don't have a say in where those revenues are spent. But if you were looking at the core budget or the core expenditures, we actually ended up spending, excuse me, 23 million more in our department on services, and part of that was due to the COVID service deliveries as well. So it actually is a function of summary versus core when you're looking at those numbers. So we didn't reduce the services investments by 5 million. That would have been in the overall outside of where we have direct access or direct involvement services that RHAs are able to determine where the monies go.
The member for Union Station.
So just so that I'm clear, is the minister saying that the reason why the reported consolidated spending for the department was down 5.8 million is due to the decision-making of the RHAs, so that spending decrease of nearly $6 million is a direct result of how the RHAs are determining those funds need to be spent? I just want to make sure I'm really clear.
The Honorable Minister of Mental Health and Community Wellness.
Thank you. So yeah, I was using that as a generic sort of example in terms of there are other sort of revenue sources that come in that don't impact how we influence different services. But we believe that the majority of the amounts that you're referencing have to do with a flood that happened at AFM. And they made an insurance claim, so the insurance paid out. And then that led to a lot of the significant improvements that therefore we didn't have to then invest in, because insurance paid for the upgrades and the reparations after the flood. So then that insurance claim that would pay for that, there may have been projects that we would have had to expend on, were covered under the insurance claim.
The member for Union Station.
Does the minister have available the amount that was related to that then, with AFM?
The Honorable Minister of Mental Health and Community Wellness.
Thank you, Mr. Chair. Again, the specifics of the amounts that the insurance would have had to pay out, you can find that actually online for the annual report for AFM in the 2020-2021 year. And it is roughly around that 3 million mark, but you can be more accurate in the numbers. It's a public report that's accessible online. In terms of the overall discrepancies there, some of that also relates to one-time pressure costs, including for COVID expenditures that wouldn't be seen year over year if the same strain or needs were not present for COVID in the following year.
The member for Union Station.
I thank the minister for that response. In the annual report, the consolidated statement says that spending for psychiatry is down $24.7 million year over year. The details of that, however, are not broken out. Can the minister explain that?
The Honorable Minister of Mental Health and Community Wellness.
While my department looks up some of the details there, I just wanted to get back to a question you had earlier about the amount spent on the contract for consultation. We don't have a specific number for the reasons I had stated earlier, but the contract itself that was signed said that 30% of the overall expenditures would be spent on consultation. So we know that we did expend fully the $450,000, so 30% of that was spent on consultations.
The Honorable Minister of Mental Health and Community Wellness.
Thank you, Mr. Chair. The numbers that you're referring to was actually not a reduction of 24 million from psychiatry. That was actually a reallocation or reclassification from psychiatry into the health authority line.
The member for Union Station.
Thank you for that response. So given this is a newly created portfolio, newly created department, obviously there's going to be new expenses, right? The minister's salary and support has resulted in an increase of $938,000, nearly $1 million, and executive compensation and support overall, therefore, is up nearly $1 million, as I just stated. And yet, spending in the department, I know we've kind of gone over it already, but spending in the department overall is down nearly $6 million. Now, the minister has provided a little bit of clarity around some of why the number is what it is, but there's still a gap. There's still a decrease there that is, based on my quick math, unaccounted for. So can the minister explain why, despite the increase in these funding, quite frankly, for salaries, et cetera, why there's still this decrease noted when you look at the consolidated numbers.
The Honorable Minister of Mental Health and Community Wellness.
Thank you, Mr. Chair. So again, I know that the member is asking for sort of more details on, that 5.2 million or so gap there. And we'll have to take that under advisement. But what I can say is that in terms of the core services provided, we have invested 23 million more year over year in those core services. So there hasn't been an under expenditure in mental health services for Manitobans, but there is a number of accounting practices that is certainly beyond some of my own understanding that I trust my department will be able to come up with, the explanation. And I know that sitting on Treasury Board myself, we had to learn about a whole bunch of terminology about how money is spent and used and moved in terms of the needs of different areas. So we'll have to take that under advisement and let you know sort of the remaining gaps of funding where that was.
The member for Union Station.
I thank the minister for that response and for offering to take that under advisement. We do look forward to receiving that clarity once it's available to be provided. Departments used to provide in their annual reports a 5-year history of expenditure and staffing in their annual report. That was true even for new departments, so that we could see the appropriations through time. Can the minister provide that for us? And if it's not available, an undertaking would be acceptable as well.
The Honorable Minister of Mental Health and Community Wellness.
Thank you, Mr. Chair. Just want to clarify if the member is asking for the total funding amounts year over year for these positions, or are you asking for the total FTEs comparisons?
The member for Union Station.
I don't think I need the FTEs. If you could provide the total expenditure, I mean, if the minister is willing to also provide the FTEs, why not? The more information, the better. I do think I have that. However, if it is available to the minister, I would certainly appreciate it.
The Honorable Minister of Mental Health and Community Wellness.
Okay, so I have, starting in the year 2017-18, total expenditure of $330,806,100. In 2018-19, a total of $341,599,600. 2019-2020 is $345,301,400. And then you'll have the numbers for 2020, 2021 in the report.
The member for Union Station.
Thank the minister for that information. Can the minister provide a breakdown of all of the positions? So a breakdown of all of the staffing as well. I count just over 40 positions in the department, but I'm wondering if the minister can provide a comprehensive, the data around the staffing in totality. So that's the expenditure information, but I'm hoping you have the staffing as well.
The Honorable Minister of Mental Health and Community Wellness.
Thank you, Mr. Chair. Yeah, so in terms of the breakdown of staff, previous to our department being developed, there would have been 11 FTEs in the department, plus about 500 staff through the Selkirk Mental Health. And then they've been moved over to shared health. So we right now are at 43.7 FTEs. If you want a full breakdown of everyone within the department, that's best asked actually through the finance department. They'll have access through the central services to know which positions are broken down into each department.
Member for Union Station.
Thank the minister for that, that response. I understand that finance would have that breakdown. I am a little surprised that you don't have that information. I would have presumed somehow the department would have that information in terms of clarity around those details. But I will, I'll ask our other critic then to maybe put that forward. Can the minister provide the overall vacancy rate for her department and the current number of vacancies by sub-appropriation in her department?
The Honorable Minister of Mental Health and Community Wellness.
Thank you, Mr. Chair. Okay, so to answer the question and breaking it down for each section of the department. So for corporate services and strategic initiatives, the vacancy rate is 37.5%, and that's
The hour being 5 p.m. Committee rise.
I had it.
It has to be exact.